My name is Paige Myers. I'm the program director of our integrated plastic surgery residency. My practice is mostly breast cancer reconstruction with a focus on complex microvascular reconstruction. This year we welcome new leadership, Dr. Allison Steiner-Rohr joining us from WashU as our new chief of plastic surgery. Dr. Jessica Sue is our associate program director as well. Additionally, in our leadership, we have one of our chief residents take on the role of the administrative chief resident. This is quite an honor. It does take a lot of extra work, but the administrative chief resident is in charge of putting together the schedules, navigating a lot of the different things that can happen during residency. Well, the mission statement of our section is to inspire and train exceptional and compassionate plastic surgeon leaders that can make a diverse impact within the field. This means that within the academic plastic surgery model here, we really focus on making you the best version of you. We talk about the academic tripartite mission in terms of clinical care, research, and education. And we try to focus on what matters to you the most. We all recognize that everyone has different strengths, and our goal in our plastic surgery leadership is to make you the best that you want to be. I think one of the most rewarding parts of my job is to be able to see the growth of our surgical residents, not just in terms of their surgical skill, but also as they grow as clinicians and people. I think that one of my passions is really finding out what people care about and then really developing that within each person that comes through our residency. Our goal obviously is to make you the best surgeons that you can be, but I think one of the special things about the University of Michigan is that we really invest into everything else. We invest into your personal growth, your leadership goals, any innovation efforts you might be interested in. It's really the extra stuff that really makes us special. We are committed to excellence at all levels, from technical mastery to academic productivity and research, to developing real surgeon leaders that have a diverse impact in the section of plastic surgery, to pushing the boundaries and innovation in plastic surgery. We also really want to invest in our residents as people. So that means giving them the freedom to grow their families, develop other passions to make them ready for an exceptional career in plastic surgery. We have leaders in the field of diversity and equity, surgical leadership. We have experts in surgical education, as well as safety and quality. So our residents are truly exceptional in all the different levels of plastic surgery. We really have the depth and breadth of plastic surgery within our section makeup. We have faculty that are experts in hand surgery, craniofacial surgery, microsurgery, as well as gender affirmation surgery, and aesthetic surgery as well. We have 4 residency spots a year. We have 1 inpatient APP that helps with some of the stuff on the floor, and we have multiple fellows that really enhance our training experience. So the integrated plastic surgery residency right now is 6 years. We do have a dedicated academic development time that all residents will pursue. Generally, that's 1 year, and usually it starts after your PGY3 year. Our residency is graded, so the first year you will spend 6 months in plastic surgery rotations, and then the rest will be in other different rotations, including some general surgery months. By PGY2, you're 8 months into plastic surgery, and then usually by your PGY3 year, you're pretty deeply involved in just all plastic surgery rotations. We have a very diverse breadth and depth of our patient population. We have people coming from all over the state for our expertise in care. That includes Northern Michigan and the Upper Peninsula, which is a little bit rural, so some really interesting pathology that you might not necessarily get to see everywhere else. Our craniofacial surgery is unique to our program, and so we get all different people coming across the state to recognize that. Our core rotations, we have 5 core plastic surgery services. The red and blue services are heavy reconstruction, a lot of microsurgery. Our silver service is kind of a grab bag. It has some aesthetic surgery, some gender affirmation. Our hand surgery service is all hand, and then our gold service is craniofacial. We do have a lot of other opportunities for our rotations. Our residents rotate at the VA, as well as our community hospital rotations, which is, again, a lot of heavy microsurgery. The majority of our time is spent at the main hospital right at the University of Michigan in Ann Arbor. We do have a few outpatient surgery centers that our residents also rotate through. This is East Ann Arbor as well as Brighton. They're all very close. We have a small community hospital where we actually do a lot of breast micro. This is Chelsea Hospital. It's about 20 minutes away. Our residents rotate through the VA, which is just down the street. Those are the majority of the rotations that we have. Our academic development time is a really unique benefit to our program in plastic surgery. This is an opportunity after your PGY3 to delve deeper into some academic pursuit. We understand, though, that everyone has different passions, and so our goal as a leadership is to individualize this experience to make it the most beneficial for you. So certainly this could be a basic science lab. We also have a lot of opportunities with health services research, but we also have a lot of opportunities for surgical education and administrative leadership, as well as some volunteer opportunities residents can really pursue during their academic development time. Within their academic development time, residents are extremely productive, and this does come out to a lot of publications and presentations, a lot of book chapters often, but there is so much more than just these metrics. So we have our residents teaching a lot during their academic development time. They are required to apply for funding, although your salary is supported if this doesn't come through. Within the academic development time, there are a ton of resources out there residents can take advantage of. We have a lot of residents pursue opportunities through the Center for Healthcare Outcomes and Policy. There is the Center for Innovation, as well as basic science and surgical education. We have a very robust global health program that is really popular among the residents. But like I mentioned, we're really invested on your individual passion. So if you have a motivation or a desire, we can really work to make it happen. So our educational experience is really robust here. Our residents are super busy. We always exceed our case numbers. The residents are always really involved in the OR. We do have the luxury of a lot of real experts in our field. So we really cover the depth and breadth of plastic surgery, from real basic reconstruction procedures to really complex mental surgery and other types of nerve reconstruction and things like that. Outside of the operating room, our residents also have a really unique experience. I think one of the strengths of our program is, as leadership, we're always looking for different types of feedback about how to improve this process and recognizing that everyone learns differently. So in the past few years, we've really tried to diversify our educational experience so we can maximize this for everyone. We've instituted quarterly cadaver labs led by our faculty as well as outside faculty to really get some hands-on experience outside of the operating room. Currently, our didactics are on Thursday morning. This is a mix of resident-run and faculty-run discussions. We also have a microsurgery sim lab that the residents get to go to with our microsurgery fellow as well as our faculty. So another really unique experience that we have is the resident cosmetic clinic. This is an amazing opportunity for you and your chief here to get a lot of autonomy and practice having your own patients. So the residents rotate through weekly. They see their own patients for non-surgical facial rejuvenation, as well as seeing their own operative candidates, staffing with a faculty member, but then taking that patient to the OR. It's a really great experience because you get to make those decisions and have true ownership of that cosmetic patient. We all recognize how critical this is to resident success. We offer a lot of organic mentorship opportunities just by rotating through faculty, but we also have a formalized mentorship system. Faculty and residents can join a mentorship committee, and then the residents and faculty are paired into these houses. So this is typically a senior faculty, a junior faculty or mid-level faculty, junior residents and senior residents. And it's kind of this house setup where residents are encouraged to meet with their senior resident pairing as well as faculty and the residents. And we meet a few times a year, as well as have a few opportunities throughout the year to meet as a group and focus on some of the new mentorship literature, but also just have a little fun with this. And I think this is a great system for us because it allows residents to meet with a lot of different people, a lot of different faculty that you might not necessarily interact with commonly in your junior years. And then that relationship can grow, and as you start to solidify your subspecialties, your mentorship might gear into that faculty that practices that. We are deeply committed to wellness, and this is wellness across all different facets. So we do have an Office of Wellness that offers a lot of resources to residents in various capacities that they might need. The Office of Surgical Education is another great resource to really bolster your learning opportunities. A unique thing about our trainees is that the house officers have a union. And so through this group, they've negotiated very competitive salaries, necessary time away from work, all these benefits that you might not get at other programs. And we're often asked as potential residents come through about what makes a resident thrive at Michigan. And I think a deep sense of service and commitment to each other, to our patients, and then to being the best that we can be every day is really what makes us special and unique, and the culture that we're all deeply committed to here. One of the other goals that we really tried to focus on in the past few years, especially in the post-pandemic era of academic training, is this real sense of building community. And so another side of our commitment to you all as residents is to really foster that spirit of community. So in addition to our mentorship committee, we have a social committee, and that's again fully funded by the section, and we try to organize these events that are just for residents, just for faculty, for all the families, to really work on building that sense of community within our program.